Welcome to Feminism Today, everyone. I'm Sophia Johnson in New York. The Biden administration announced plans to reduce homelessness in the U.S. by 25% by 2025. So what's the best way to address unhoused population? And how exactly does the administration plan to reduce and prevent homelessness? We talk now to Professor Deborah Padgett, author of Housing First, Ending Homelessness, Changing Systems and Transforming Lives, which documents the rise of a paradigm-shifting approach to addressing homelessness in the U.S. and abroad. She joins us to discuss the best way to address unhoused population and really to dig into the administration's plan. Professor Padgett, welcome to Feminism Today.
Thank you very much. I'm happy to be here.
I'm so glad. So let's start with the plan. It's called All In. And one of the goals is to reduce homelessness by a quarter by 2025. What are the steps being taken to get there?
I haven't read it in great detail, but my take of it is that rather than come out and favor any specifics, to talk more about coordination across departments and facilitate services and more cooperation. That's been one of the big problems in homeless services, is that a lot of the actors on the scene of helping homeless people are all working in their own kind of silos. And I think what the Biden administration wants to do is to provide incentives for local organizations. And I'm talking about police departments, parks departments, nonprofits, faith-based communities, all sorts of community-based organizations to come together and develop a plan. And there is additional funds. So there are a fair amount of money put forth by the Biden administration as an incentive to do this. So hopefully it will work in galvanizing people in local areas around the country.
I want to get to the budget in a moment, but for now, I want to talk about prevention. Prevention is obviously a key component of the plan, as you rightly mentioned. How does the administration hope to prevent people from becoming unhoused?
Well, it depends on how far you want to go upstream, so to speak, because to prevent homelessness, we would ultimately have to go back to the time starting in the 70s or ending in the 70s when we had enough affordable housing, by and large, for people in this country. Then beginning in the 80s, the federal government just stopped building public housing and stopped really investing even in rental vouchers to any extent. So if you want to prevent it, ultimately you want to have affordable housing and you want the government actively involved, because the process of doing that has been turned over to private developers. If you want to talk about an individual, let's say a family that's facing eviction, what is often used are what's called rapid rehousing. And these are small amounts of money, not a huge amount, but enough perhaps to pay back rent, to pay a medical bill, to repair the car, something that will get the family back on track, but not require a large amount of money, because by and large, their only problem is they can't pay the rent for some period of time. So the rapid rehousing is what's done for that. But in the long run, I would say we have to have some fundamental structural changes in this country in the way that housing is built and maintained.
You touch on a very important point, sort of dating back to the 70s. I wonder if we could return to, for our viewers, a definition of homelessness, or, I think it's really important for us to really understand how the administration is defining homelessness. How would you define homelessness and the unhoused?
Well, the general, it depends on where you are. Europe has a much more expansive definition than we do, but by and large, it is sleeping or living in a place not fit for human habitation. And that leaves it open to what are the manifestations of that homelessness. You may be sleeping in a car, under a bridge, or in a shelter. In any case, these are places that are not fit for human habitation. The U.S. Department of Education has a slightly more lenient definition. They include that. But as for children in schools, they also include children who are doubled or tripled up and are living in crowded circumstances. So that's a different statistic, but by and large, we hear the main one, which is what comes out of the point in time counts every year and are reported to HUD and then reported out for public consumption is the numbers. And even though they're always undercounts, we often rely on the differences over a period of a year, 2 years. Look for trends. Even if the exact numbers aren't quite there, you can kind of see if things are going better or going worse or staying somewhat the same.
Now, as someone who's done an awful lot of research on this topic for some time, what are your thoughts on the plan, on this federal plan? Is this the best path forward?
I'm in favor of anything after the past 4 years, or since 2016. We were going backwards from what was already a deep hole we dug ourselves in because, homelessness really became a crisis in the late 1980s. And most of us thought that would pass. It's an epidemic. It would see it through, but it hasn't. It's continued. So I think what we're seeing is just really more of the same and an inability for various continuums of care, as they're called. These are local collaborations of entities, nonprofits usually, who come to HUD for funding. But what they're doing is kind of playing catch up because even if they get more housing vouchers, we still only have enough rental vouchers on average for 1 in every 4 families who are eligible. So we've got a really deep hole we've dug ourselves in. And so when people get impatient about ending homelessness, I have to say this has been going on for 30 odd years. And this goal of 25% by 2025, I'm all in favor of goals, but we've had 10-year plans, many 10-year plans. And sadly, it doesn't always work out, even if there's a lot of incentives built in, as the Biden administration has done. I'm still hopeful, of course, and it's better than nothing. And in some cities and in some populations, we've really made a difference.
So the plan is ambitious. You're hopeful. Let's talk a little bit about funding, the funding piece for a minute. How much has been allocated for this plan? And do you think it's enough, really? I'm seeing somewhere around $3.1 billion. Is that correct? What's your sense of, where is the data landing?
I am sorry, but I have not read it in great detail. So I really can't tell you that. But I can give you a comparison that, yeah, $3 billion is a lot of money. And it's considered a really unprecedented amount. I mean, that's about the annual budget of HUD. So it is a considerable amount of money. But I can tell you here in New York City where I live, that is the annual budget, $3 billion for homeless services in this city. And every time I hear that, I'm just in shock because even though we do have, 68 or so thousand homeless people and one of the largest outside of California, we spend more per capita than any place in the United States. And the results are not encouraging. It's full shelters and people still sleeping on the street. So I have no doubt that the Biden administration is putting funds forward and trying to create incentives for more cooperation locally. And, we have some examples from the city of Milwaukee, for example, where this was done starting in 2015, and they cut their homelessness by 92% by bringing people together all on one page. When you have people saying over here, I want a shelter, over here, I want them in some kind of encampment away from the city. When you have these different conversations going, you need to concentrate. And I'll be honest, the data is profoundly in the corner of using what's known as housing first as the intervention. So that's the key, in my opinion, to making a difference.
So you introduced a couple of interesting thoughts. I want to know if we can talk a little bit about this sort of the comparison between what's happening in a New York setting versus what's happening on the West Coast. What do you think, what is really attracting? Is it really just economics that's attracting or contributing to the rise in homelessness in New York City in particular?
It's a lack of affordable housing, but it's also the lack of political will to change the status quo. And just to give you another example, during the COVID pandemic, there was a really phenomenal rally to get buses, put people out of the shelters, take them out and put them into hotels. Some of them were quite nice hotels. So these are individuals who've been on the street, in subways, in shelters, suddenly found themselves in hotels. And most of us were talking about, us being advocates, the fact that this was kind of an inflection point. Maybe these hotels, many of which will not recover, could be converted to like studio type units of housing. And that really reached from California to New York, that enthusiasm. I think they are doing some of that in California, but I'm sorry to say there's almost nothing, maybe a little bit here, but the city took the inhabitants of the hotels, put them back in their shelters with no explanation given for that. And those hotels, many of them are still sitting empty.
Wow.
And the shelters are full.
You mentioned very briefly Milwaukee, the successes there. Can we talk about a little bit about what success looks like in terms of reducing those numbers? What would success look like in New York?
Well, first of all, we'd have to envision a future where there were efforts to change hotels into living quarters, empty office buildings. Now, I realize that this is easy to say, and between zoning laws and building permits and the incredible delays in getting anything done in the city, could preclude any really rapid change, but it would be at least be going in the right direction and investing what is otherwise money spent to private landlords to rent crowded, unpleasant shelters. So I think success would look like, well, we could almost immediately, if we had some of these rooms and studios, take the people who are on the street. There are about 2,000 to 3,000 people, homeless people, who do not want the shelters for very good reasons. But, most people are in shelters. But I think if we had like studio apartments or small units, people would leave. In our experience, they will get off the street. They're not enjoying the freedom of the street or whatever it is that, anti-homeless people say about them.
Let's talk a little bit more about your experience so viewers can better understand what you're seeing and what you've seen in terms of your research.
Well, my career began in earnest in housing, with Housing First. So my initial experiences were what I consider almost the miracle of Housing First, because it was taking people from the streets with mental illness, almost always with substance abuse problems, putting them in an apartment, providing services, it's not housing only, and seeing this incredible change. They're off the street, they stay off the street. The success rates are 80 to 90%.
Wow.
Whether in the US or Canada or any country in Europe, the rates come in like that. So it's pretty solid way of ascertaining what it would do to change. I think that we would see, like I said, I think we would immediately see fewer people on the street. And the people we see are usually single adults, usually men, may or may not have a mental illness. Certainly, we've been focusing on people with mental illness lately because they have done some things that are pretty horrific to people on the subway tracks and so forth. But I think that people from the street would gladly accept a voucher or an invitation to a small studio apartment of their own. And then we would turn to families, which we are trying our best, but we're still paying a lot of money for crowded buildings where we put families. But I think you would see a gradual, I think what they saw in Milwaukee is just every year at their point in time count, fewer and fewer people, to the point where the last point in time count, I was just watching a video on this, 17 people on the street.
Wow.
And this is a city that had at least 1,000 people homeless and, or otherwise in shelters. They don't have a lot of shelters, but they did have shelters. But when you get down to double digits or single digits, something's working. And in this video, they literally brought in the stakeholders, the police, the parks department, the courts, the nonprofits, the county executive. They all came together and said, let's find the barriers, find a way to eliminate or just minimize them and get people housed. And It has worked. And when you do have a working formula, which to me is almost always housing first, you save money. That's the other, to me, it's inconceivable that we're not doing it, and you can make the saving money argument if you don't want to make the let's save humanity and make life worth living for so many people who are in misery. But if you want to be more hard-nosed about it, housing first, paying rent and the services they need are on an annual basis save money compared to a jail cell, a cot in a shelter, certainly than an emergency room visit, etc.
Let's talk a little bit about the intersection of poverty, mental health challenges. It goes on and on and on. I think people think about homelessness as an individual failure, but I want to really reset that thinking by helping people to understand the intersection of all these different factors and variables. Can you talk to us a little bit about that?
Yeah, I mean, first I would say that even though many of us only see the behaviors of people who are clearly disturbed in public places, actual figures, and there's been plenty of research on this, of people who have a serious mental illness like schizophrenia or bipolar disorder, only about 30% of homeless people have a serious mental illness. A higher percent have substance use problems, but a fair number of homeless, and also I want to raise this point, which is really important. The homeless population is getting older. The baby boom generation has reached that age. And what we're seeing are needs that are not only just the basics of housing or supports and rent, but once people are in, thinking of dementia or falls, they're losing 20 to 25 years off their life just for having gone through all they've gone through. But to make at least the remaining years of their life livable, the humane thing would be to provide housing. But I will say that I completely understand and I sympathize with people who say these people with mental illness are walking the streets, causing harm on occasion, although compared to the numbers, it's really not that high frequency. That something needs to be done. And that something in California is care courts, as they're called, or smoothing the way to mandated psychiatric treatment, basically. And we have the legal right to shelter in this city. So anyone can have a shelter bed that asks for it legally. That's not true in other parts of the country. But as I said, going into shelter is not one of the more desirable alternatives. Word is out on the street. And
yeah.
I mean, they don't let the press come in to see it, but you get vivid descriptions. And we've interviewed people on the street, on the sidewalks, in the parks.
Yeah.
We've interviewed people living in the hotels during the pandemic. And there's a consistency to the message.
Since 2020, the veteran homelessness has actually dropped by 11%, and that's the biggest drop in 5 years. How was that achieved?
That's a great question. And actually, it's dropped over a longer period by almost 50%.
Wow.
And the reason is that the VA, starting, I should have looked up the timeline, it's probably around 2010, started talks with HUD, and they started what was called the HUD BASH program, HUD VA Supportive Housing Program for homeless vets, veterans. And what they did in this program is really the systems came together and did what they needed to do to help veterans. Number one, they had, which we rarely see in homeless services, a rental voucher. So when they approached a veteran on the street, they could offer not only a place to stay, but a rental voucher, which is basically for life. So most homeless services cannot do that, and that's understandable. So I think the key to success was rental vouchers, but they also VA personnel had to get used to going to people's homes, their apartments, not coming to the clinic. The VA is, we stay here, you come to us. That had to change.
Yeah.
they had to change their attitudes about substance abuse. Although I think harm reduction or, tolerance of substance abuse and working with the person to end it was known in the VA, but many people kind of still had an abstinence mentality. Many of the older psychiatrists, psychologists, social workers. So we had to get past that prejudice about that, because the research has also shown that once people are indoors, they may continue to drink or to use drugs, but they frequently lessen that over time, because they tell us when we talk to them about it, I have something to lose now. Yeah. I have a place to live. So to me, the HUD-VASH story is one of the best success stories we have and have had in the past 20 years.
Yeah.
And it's strictly following the formula of backing up the promise of support services with a ramp to housing.
Now, LA Mayor Karen Bass announced a new program that will move people living in encampments to hotels and motels, a little bit of what we saw during the pandemic. I wonder, what recommendations do you have for cities seeing the types of numbers that they have in LA?
Well, no city's going to have LA's problem, right? Because they ignored it for decades and decades. And, in the last few years, has California really come to see the extent of it, and it's no longer just on skid row. But even smaller cities are finding success. Let me put it that way. Yeah. Charlotte, North Carolina has had a really good success in lowering their numbers. Salt Lake City did for quite some time, decrease their homeless numbers. So to me, it's where there's a will, there's a way. And there's plenty of help out there for, technical assistance, shall we call it, or from HUD and from researchers and advocates and so forth, to help cities find a path to get the cooperation together to not only secure the federal funds, because even though New York spends a lot of New York money plus federal, most places are reliant on HUD for virtually all of their funding. So they have to apply to HUD, and in most cases, they have to show some commitment to housing first. And to me, that's a winning formula. But I also feel that California has such an enormous problem, and they're almost all out of doors, not living in shelter, that it's going to take extraordinary measures. I think Mayor Bass knows that and has been working on that. But I think it would be unfair to impatiently expect, major results right away. It's going to take a while. Other cities, I think, are smaller. They have smaller numbers of homeless, and where they come together and cooperate, and you work with landlords, by the way. I mean, a big part of the success of this, because ideally it is scatter site. It's not like buying a whole building and putting people in there, because then you're creating institutional living, which is no one's really satisfied with. But when groups come together, work with local landlords and find ways to make them see there's even advantages for them. The rent gets paid on time. It's really important that the support services for people living in supportive housing include not only psychiatric help and medical help and so forth, but also ways of surviving, like job training, opportunities, social outings. We, at one point in a program here in New York, had a family counselor available for homeless people who had long since lost contact with their adult children or their relatives, but wanted to reunite. So people get housed, and then they have needs beyond housing. And that's, to me, the ultimate test, is how to get beyond that.
The U.S. Department of Housing and Urban Development had just recently published a new report showing that women were a slightly larger percentage of individuals experiencing homelessness in sheltered locations than in unsheltered locations. The number is between 32% versus 28%. Can you speak to the experiences of women and the rise of homelessness or unsheltered living conditions?
Well, what that tells me is, and this happens in New York, if the typical homeless woman is a young woman with maybe one or two young children, I mean, the most the highest number of homeless people in the city are children. Let's
Yeah.
face it. So if you have a young woman facing being kicked out of her apartment, or domestic violence is often a major contributor to female homelessness. So in New York, they have to go to an entry called PATH, a center in the Bronx, and they must apply. But fairly quickly, families are put into some form of housing. It's usually not great. It's crowded. It's not very good, but it's something to keep them off the streets. I think everyone agrees this is it's not good for children to be in shelters, for starters, but on the street is just unconscionable.
Yeah.
So you will see more women, and actually families constitute a large percent of homeless overall, and their needs are kind of simple. They're economic. I mean, yes, you may have some emotional problems that can be dealt with, but by and large, it's I don't know if you've heard of the game of musical chairs, where
Yes.
you circle the chairs. That's kind of what being homeless is. You're circling the chairs and your time was up.
Yeah.
And you're the one. There's no way to predict very well, except poverty.
Right.
But within that category, who is going to become homeless and who's going to stay housed? It's very hard.
I want to finally sort of end on the rising concern very recently in New York, some southern states, Florida, Texas, sending recent migrants up into more liberal spaces. I know you haven't done a lot of research on this, but I want to know if you could sort of help us understand, what do policymakers get right or wrong about homelessness? And what is wrong or right about sort of sending migrants in buses all across the country just to be homeless?
It's morally absurd and wrong what they're doing. I mean, and it's political. It's a political statement, because Florida sent busloads of migrants, mostly from South America, to New York. And this is on top of the 60,000+ people we already shelter. And I can't say the city has done a very good job. I mean, at times they did put them in hotels like they did during the pandemic with homeless people. There's, these places like Texas and Florida are trying to, teach us all a lesson. It's a very sad lesson to teach. And I will say New York is struggling with that and not doing a very good job with it. And I worry that it's because they think somehow the federal government will rescue them or something. I'm not sure what it's about, but it's not a good look right now. I mean, some are sleeping on the streets. They're on cots in stadiums and gymnasia. It's a very sad turn of events that has complicated even more the prior existence of all of these tens of thousands of other people without homes. So to me, it's a moral failure of a major caliber to watch this happen and do relatively little. I mean, I think they're scrambling in some way, but I also feel that there's this sense that someone's getting something for nothing or something. I don't know. But I will say these are younger people, the migrants. They want to work. They're generally in good health. Some of them may have traumas from their home countries, but I think the prognosis for them would be good if they could get housing and stabilize. They wouldn't need a lot of support services.
Deborah Padgett is a professor at the Silver School of Social Work at New York University. It was such a pleasure speaking with you. Thank you for your time.
Thank you. I really appreciate it. I've enjoyed it. Thanks.
That's it for our program today. Remember, you can follow me on Instagram and watch and rewatch and get caught up on past episodes online, or sign up for the newsletter at drsophiajohnson.com. Thank you so much for watching Feminism Today on Free Speech TV. Join us again next week.